Assalamualaikum warahmatullahi wabarakatuh to Madam Mariana and my fellow classmate. My name is Muhammad Syarif Azmi bin Zamzam. Today my group and I will present to you about sprain and strain. What are sprain? Sprain is an injury to a ligament, which is tissue that connects bones to other bones. Joints contain many ligaments. A sprain results when a joint is twisted or pulled and the ligament is stretched or torn or torns. Okay, the symptoms of sprain are pain, swelling, and having a problem moving or using the injured area. So the most common sprain in athlete is ankle sprain. So in another slide, I show to you about how sprain or the ligament is stretched or torn. Okay, for the next is what is strain? A strain is an injury to a muscle or a tendon, which is tissue that connects muscle to bone. Like sprain is bone to bone. Okay, sometimes the strain is called a pull muscle or torn muscle. A strain happens when a muscle or tendon is stretched too far or is partially torn. Okay, for the symptom of a strain are pain, swelling, and having a problem moving or at the injured area. The hamstring, which is thigh muscle, calf muscle, and Achilles tendon are the common injuries in strain. As in sprain, I also provide to you about a picture where the tendon or muscle tissue is stretched or torn.
Assalamualaikum, my name is Natasha. So I will explain about types of sprain and also strain. So as you know, sprain is injury to a ligament and strain is injury to a muscle or tendon. So there are three types of sprain, which is grade 1, grade 2 and grade 3. So for grade 1 ankle sprain is actually lateral ligaments are strained, mean overstretch. And then for grade 2 ankle sprain is partial tearing of one or several these ligaments, mean it is larger but incomplete tear. So lastly, for grade 3 ankle sprain is complete tear one or more of the lateral ligaments, means it is actually complete tear. For grade 1 ankle sprain, it is actually does not feel loose or wobbly. The patient is able to fully with bear and walk. So although it is likely to be painful, the patient is still able to walk because it is still not worse. So for grade 2 ankle sprain, the patient may walk with a noticeable limp, means the patient may hear or feel a pop or snap at the time of the injury, and the moderate to severe pain and swelling may restrict patient movement. Lastly, the type of sprain is grade 3 ankle sprain, which is usually the patient will hear or feel a pop or snap at the time of the injury. And then the symptoms are sometimes less with a complete tear than with a partial tear. When patient joint, it will feel loose or wobbly, and patient may hear a grating sound when they try to move the joint. So basically, the patient is unable to walk when they already at grade 3 ankle sprain. Right now, I will explain to you about types of strain that we have. So as you know, strain is injury to a muscle or a tendon. We have three types of strain, which is grade 1, grade 2 and grade 3. Firstly is grade 1 type of strain, ankle strain. So sharp pain at time of injury or pain with activity. usually able to continue activity. So the signs is actually mild pain and localized tenderness, and mild spasm and swelling, and no or minimal loss of strength and range of motion. For grade 2 of ankle sprain, is the patient is unable to do any activity, and the signs is clear loss of strength and range of motion. So lastly, for the grade 3 of ankle strain, the patient is immediate severe pain and disability, and the signs is actually complete loss of muscle function, which is the patient is unable to do anything, and the muscle is cannot be used.
Okay, next is we're gonna talk about what it is caused by sprain. As you know, the sprain is an injury that come from tissue that connect ligament and joint. The first causes of sprain is injuries from contact sport such as football, rugby, wrestling that require you to contact other opponent. And the next is walking or running on an uneven surface that can cause you imbalance that cause a sprain. And the next is twisting or pivoting suddenly, such as basketball, netball, when you want to change the direction immediately. And the next is you falling and landing on the wrist or hand. And the next is playing a racket game such as tennis or badminton that you use your wrist a lot. Okay, next is what it is causes by strain. First is slipping and falling that can maybe injured to your muscle when you fall. And next is any sport that require throwing, jumping and running. When you use that muscle repeatedly, it can cause a muscle strain. And the next is lifting heavy weights that can make your muscle expand and they can cause the muscle strain.
Assalamualaikum warahmatullahi wabarakatuh. My name is Ungku Namsyudik bin Muhammad Ali. Okay, today I will explain about the sprain and strain treatment. Okay, my friend have tell you about the type of sprain, causes of sprain. I hope you can understand about it. If you don't understand, you can ask us during the Q&A session. Okay, so I have put 3 treatment in this slide, which is first is rise and price assessment. Second, pain and inflammation management using the NSI, which is non-steroidal anti-inflammatory drugs. And lastly, medical surgery. Okay guys, right now we explain about the sprain treatment using the rise assessment. I know you guys have learned about the rise assessment during 3rd or 2nd week, I guess. Okay, rise assessment divided by 4 steps, which is first R for rest, I for ice, C for compression, E for elevation. Okay, first step, when you want to give the treatment for person who have been injured by sprain, you need to first is rest. You need to avoid the activity that can cause pain to the victim. Second is ice. Ice the injured area, which is 15 to 20 minutes and repeated 2 to 3 hours. Make sure the ice is wrapped by cloth or handkerchief or anything. Don't directly put the ice to the victim's skin, because of it will harm the victim's skin. Putting the ice directly to the skin will harm the capillary and beneath the skin. Okay, so make sure rub the ice. Okay, third step is compression. Compress the injured area with elastic bandage until the swelling stop. Make sure don't rub the injured area too tight. because it will worsen the injury. Okay. Lastly, the elevation. Elevate the injury part above your heart. Okay, I have done explaining about the rise assessment. Okay, right now I will explain about the price assessment. This assessment suitable to treat muscle strain. Okay, price and rise assessment is similar, but price just add protection to the step. Okay, price assessment divided by 5 steps, which is first is P for protection, R for rest, I for ice, C for compression, E for elevation. Okay, first step, protection. Make sure if protect the strain muscle from further injury. Second step is rest. Rest the strain muscle and avoid it from performing any activities, which is activity that can worsen the muscle strain. Third is ice. Ice the muscle area within 15 to 20 minutes for 2 to 3 hours. Make sure, like I said, don't put directly ice to your skin. Next step is compression. Compress the injured area with elastic bandage (OS) to decrease the swelling. And lastly, elevation is the same. It is same step with the rise. Means put the injured area above from your heart. Okay, right now I will explain about the second, which is pain and inflammation management using the NSID. Okay, for your information, NSID are member of a drug class that reduce pain, decreases fever, prevent blood clots, and in higher doses to decrease inflammation. So in the slide, I have put 3 examples of NSID, which is ibuprofen, acetaminophen, and aspirin. Okay. Lastly, I will explain about the medical surgery. Consult a doctor as soon as possible if there are symptoms of a possible broken bone. There are 4 symptoms. 4 signs. Okay. First, there is a popping sound with the injury. Means like if you have been injured or if you have ankle sprain or anything, then suddenly it will sound pop. Okay, so there is sign of possibly a broken bone or fracture. Okay. Second, the person cannot move the injured joint or limb or bear weight on it. Means like if they have a ankle sprain, injured ankle, then they can go evasion, or they cannot invasion or evasion. You should bring him to see a doctor as soon as possible. Okay. Third, the limb buckles when the injured joint is used. Lastly, there is numbness to the injured part. Okay, that's all from me. I hope you can understand. If you have any question, you can ask us in Q&A session. Thank you.
Is how to prevent. Number 1, avoiding exercise or playing sports when you are tired or in pain. Number 2, eating a well-balanced diet to keep your muscles strong. Number 3, maintaining a healthy weight. Number 4, trying to avoid falling. For example, put sand or salt on icy spots on your front steps or sideways. Number 5, wearing shoes that will fit well. Number 6, getting a new shoes if the heels wears down on one side. Number 7, exercising every day. Number 8. Staying in a proper physical condition to play a sport. Number 9. Warming up and stretching before playing any sports. Number 10. Wearing protective. Number 11. Running on flat surface. Thank you, that's all.
That is the athletic events that most likely to see sprain and strain occur in the athlete. So I provide to you a picture that show the sprain and strain occur in an athlete. So the first is hockey. So in sport of hockey, the MCL injury is the common injury that happen to the athlete of hockey. So the MCL injury is a knee is caused by a direct blow to the knee. So this type of injury is common in contact sport. So the next is tennis. Tennis injury is the elbow strain injury. So while in rugby and football, the most common injury is ACL and hamstring sprain. So as a conclusion, which can be concluded that sprain is a ligament injury that is instability. So the strain is muscle or tendon injury that will cause pain and weakness in our body. So the many causes that including carrying, pushing, lifting, pulling, doing repetitive tasks or working in awkward position, which will occur a sprain and strain. So the sprain and strain can be treated by using a RICE. So what is a RICE? RICE is a rest, ice, compression and elevation. So in order to prevent sprain and strain in our daily life, we need to stretching, wearing a proper footwear and use the correct equipment appropriate to the sport that we involve. So that's all from us. Thank you, madam.